Dr. Rowe is a psychologist at Emory, and she works primarily out of the VA, but wears many hats, and she's going to talk to us about anxiety and depression, and that was touched on earlier, and some of you had very good and important questions about that, and how do we emotionally deal with chronic conditions and some coping strategies and on the path to wellness. So thank you for being here, and thanks for your time.
Absolutely. Thank you, guys. Thank you for having me. So I've got a little quick agenda that I'll walk us through. I have a quick little intro about me. I'll talk about why a psychologist would be here anyway. Some common comorbid diagnoses, primarily we'll talk about depression and anxiety. And then I've got about 4 different categories of coping skills to help build your toolkit. And I hope to leave a full 10 minutes for that one. And then just some final tips. If you have questions or thoughts, I've programmed 20 minutes of speaking, so we can have 10 minutes of speaking at the end. But please interrupt me if there are specific questions that you have. So as said previously, I'm Dr. Rowe. I'm a staff psychologist at the Atlanta VA. I work primarily on the home-based primary care team, meaning that we see veterans who are medically complicated in their homes. So I work with rec therapists, there's interventionists, there's nurses, dietitians, and so we're just a full care team for veterans who would be otherwise unable to come into the hospital or are so medically complex that they would be in the hospital quite often. I also moonlight, I say, as a lecturer at Spelman College, so speaking to a group of people is quite normal for me these days. I'm a prior postdoc through Emory School of Medicine. Just last year, I worked in the psychiatry service at Grady through Emory, and that led to my current chair position on the NIA Project's Community Advisory Board. So NIA is a project through Grady serving mostly low-income minority women who have experienced intimate partner or domestic violence or recent suicide attempts. And so I help on the research side with an advisory board of people within the greater Georgia community to help kind of have this biofeedback of data that's included in research, as well as hearing a lot from the community. I'm also pending adjunct assistant professorship through Emory University, and my research comes up quite often in this area. I'm primarily interested in external factors like trauma or discrimination and their impact on health. And for me, that's largely included substance use, but in the last several years, I've looked through a gamut of health outcomes. So I'm really excited to speak with you all today about this very specific illness. And as a disclaimer, I do not represent any of the organizations that I work for. These thoughts are my own. So thinking generally about the mind-body connection, why it will be important to have a psychologist to speak with about what is going on with your health, is really thinking about the sympathetic nervous system. So if we think about our sympathetic nervous system, it's like that fight or flight response that's really automatic. So if a tiger came running in this room right now, how many people would pause to say, well, is it a nice tiger? Is it going to help me? What does it need? Not too many people, right? So most of us are going to get up and go, right? And so what that looks like in our body is kind of on this right-hand side of this image here. Your pupils will dilate, increase in saliva, increase in heart rates. Your stomach kind of gets activated as well. Your body is really prepared to either fight back against whatever this issue is or get out of there. So that's important to know in the case of cardiac conditions when thinking about that chronic pain and trauma also do the same thing to our body. Sometimes we can get stuck in that fight or flight response, even if I don't have a tiger that comes running in, right? So I could be sitting in this moment and have that automatic system of fleeing, that fight or flight, that does not actually fit the situation. And so sometimes that can be different ailments in our body. It could be experiences of traumatic events, right? A loud noise can do the same thing, or even just our thoughts, right? So is this going to happen to me again? Am I going to have another cardiac issue? How am I going to be able to pay for all of the things that are going on for me in my life right now? All of that can reverberate and look like and feel like in our body that fight or flight response being activated. And so our thoughts can have a really, really significant impact on our health, including what is most dangerous for folks with FMD, SCAD, is that spike in blood pressure, right? So I'm always thinking about that in terms of what we can do to decrease that spike in blood pressure. So one of the things that we do, or my work in chronic pain, is working with patients in a stable period, right? So we can work on things in a crisis, but also thinking about when you're stable, when I'm not in a crisis. What are some things that I can do to be more in tune with my body and myself to decrease my vulnerability to negative health outcomes later? And another value of mine in particular is just providing more psychoeducation about those mood states and how they impact our body. And so in my preparation, I'll admit that I knew not a whole lot about FMD and SCAD, but I did find this FMD, this qualitative study, meaning they interviewed a small sample of women, mostly women, there was one male in the sample, with FMD, and kind of interviewed them about their lived experience, their dealing with the chronic health condition, and what comes up for them. I thought this is a really, really helpful read. So I included the citation there if you guys wanted to look into this article. But these are the 5 common themes. And what stuck out for me is that these are my bread and butter in terms of psychology, right? So this worry and concern about death, stroke, family well-being, how are people going to manage, what vulnerability am I passing on to my children, experiences of care, am I being believed, how am I going to coordinate all these appointments while I'm at working or taking care of my children or grandchildren, symptom burden, I can't do a whole lot when I don't feel well. That's also a common thread that we hear with chronic pain, loss and change, sense of identity from, maybe perhaps an independent, self-assured person to someone that is a little bit more reserved or more cautious with this chronic health condition. And resilience being a really, really key component of those in the sample living with FMD. This idea that I have this ailment, I have this illness, and I can still live a life. I'm going to be proactive and helping myself in order to live the life that I want to live in accordance with my diagnosis. That was a really common thread. And so thinking about just generally these mental health disorders that are most likely to co-occur with chronic pain, we have depression and anxiety. And I like to put them in a Venn diagram because often people kind of associate them as similar things, which they do have a lot of shared symptoms, but there are very distinct ways of thinking about these diagnoses as well. The long and short of it that I like to think of, depression is this preoccupied thought patterns with things that have already happened, whereas anxiety is a worry or nervousness about things that have not quite happened yet. That's kind of how I think about them. But again, there's some overlapping things. And why I think it's most important to talk about anxiety in the setting of chronic pain is because a lot of these feelings that happen physiologically in our body can also feel like cardio abnormalities. And so it's really important to be able to discern what is a true emergency versus is there something that, anxiety is a true emergency for some as well. I'll acknowledge that. And when do I need to go to the ER versus when do I need to engage in these coping strategies to help me settle myself? And I also wanted to speak to panic attacks and anxiety attacks, which anxiety attacks are not traditionally identified by the DSM as a disorder, where panic attacks are, but they are physiological experiences that people have either suddenly or gradually built up over time. And again, they can feel similar to a cardiac event, right? And so one can argue that this kind of works both ways, that I can decrease my vulnerability to panic attacks by engaging in these coping strategies, and also acknowledge that part of having this illness is a worry that's going to be there. And how can I then function in accordance with this worry and still be able to live my life? So familiar stress being one of the main pieces there too. Any questions or thoughts about these quick little diagnoses? Great. So when thinking about the impact of, the reality is, let's say, we're all going to experience a stressor. Life is going to life, right? Everything is going to be thrown at us when we're not fully prepared for it. Lazarus and Folkman developed a model to explain how different people may respond to different environmental stressors that we all may be likely to experience. And the key component is a person's appraisal, their interpretation of the event. So I work a lot with veterans, and we speak about this all the time. Veterans with PTSD will argue, I had a battle buddy that was right there with me, and they're not negatively affected. Why is this affecting me? And the short answer to that is there are various things that have happened even prior to us within this traumatic event that is going to impact how we perceive this situation. And so I love this quote, this statement here: our reality is 100% based on our perception. And so in accordance with this model, if I lean into the unknown of when is my next event, when or if I'm going to have another event, am I going to be believed by my providers? If I lean into those really uncomfortable questions and thoughts, what's that going to feel like? I kind of said it already. Uncomfortable, right? My lived experience is not going to be well. Those things can be true, that I don't actually know when this event may happen again. And if I lean into what I actually know as well too, that I have a treatment plan. This has happened before and I know what it feels like. I have a plan and safeguards around in place to mitigate the impact if it were to happen again. If I lean into those realities, which are true at the same time, perhaps I won't have as much discomfort. Easier said than done, right? But this idea of the stress coping is that a lot of the impact of the stress itself is based on how we appraise that situation. And if we have insufficient resources, we don't have positive coping strategies like that reality testing one, then that can lead to more negative coping. And then again, kind of keep us in this loop of being negatively impacted by these environmental stressors. And so these next few slides, I'm going to talk through a couple of strategies. And the first main one being mindfulness. So if you think about how we just talked about depression being this preoccupation with things that have already happened, and anxiety being the preoccupation with things that have not quite happened yet, mindfulness is really being in tune with what is actually happening in the here and now. So I talk about this with my patients often, where I'll say, I can envision or map out the steps it takes me to get out of this room and on the elevator and to my car. But what if the elevator's out, right? What if there's something impeding these doors and I have to use another exit strategy? All the mapping that I just did in order to get myself to my next position would be unnecessary. And so a true mindful strategy is being fully present in this moment, one moment at a time, one-minded, only thinking about the one thing, moment by moment, and non-judgmentally. So often we'll hear ourselves, maybe if anyone in here practices yoga or belly breathing, like, oh, this is stupid, or oh, I have so many things I need to be doing, or oh, I'm not doing this right. That's that judgment piece, right? We can acknowledge that we have those thoughts, but I can circle right on back to whatever it is that I was doing. And so some helpful strategies that I like are belly-based breathing. And one of the big tenets of that is often when we breathe with a lot of labor, we're using our whole body. When really, we just need to extend our belly, right? And really get that kind of guttural breathing. Paced breathing is another helpful strategy I've seen patients use, like kind of box breathing or counting one's breaths and holding before inhaling or exhaling in order to really be in tune. Imagery is a really helpful strategy as well. If I'm in a space where I don't even want other people to know what's going up for me, I can go on a vacation in my mind. Five senses is one that I use quite often. I keep lotions in my certain lotions in my bag that smell really good for me, that would bring about a changed experience. Some people feel soft things or have dogs, with the intention being that this change can be helpful within our thoughts and our physiological experiences. And then mindful eating, that's like something that I really preach about often when we're eating. We're watching TV, we're talking to people, we're doing a whole bunch of different stuff, we're on our phones, everyone's on their phones, right? But the data says that should we focus on our food, what does this really taste like? What does the process of eating this feel like for our body? Envisioning the seasonings that are going into this. People report more satisfaction with their food, they eat less and feel fuller faster. And so there are other benefits too of just being fully present, even when eating a meal. And I'll keep these words up here because I added these here just briefly. I am a big proponent of using YouTube for this sort of thing. There are guided imageries that are 5 minutes or 2 hours. Please utilize any free resource that you can for any of these mindfulness practices. And think of it as a skill that you work up over time. Most people are not that good at it on the front end, but you build it up over time, just like you would any muscle. Some cognitive strategies, I just want to touch on a couple of them briefly. So these dysfunctional thought patterns, so often we get stuck in black or white thinking when often there are things that are gray. catastrophizing. I'm thinking kind of like the worst at all times. If I notice that that is a pattern that I have more often than not, when I am in a really stressful or stressfully activating space, I can start to modify those thoughts in my own mind and observe how that then impacts my mood. I often ask patients who get kind of like stuck in those thoughts to say, it's hard to say how I would change things for myself, but I often think about what you would say to a really close friend or family member that was experiencing the same thing. Perhaps that's a different perspective that you can take in order to help alleviate some of the distress in those thoughts. Some behavioral strategies. So this was a bit of a challenge because one of the major caveats of this condition is limiting exercises that increase your blood pressure, being mindful of that. So there are some skills like flashing cold water in our face can change our physiological, kind of bring us out of that fight or flight response, or intense exercise, but that would be contraindicated in your case. But certainly things like walking or even yoga can do a myriad of things in order to change our mood, changing our environment, seeing different things, again, engaging in those five senses really kind of snaps us into a different perspective or just kind of gets us out of those really intense thoughts or intense negative emotions. Progressive muscle relaxation, there's also YouTube videos for this. It's kind of using an evaluation of all of your muscle systems and just taking them one by one. So using my hand, intense squeeze for about 2-3 seconds, and then a really, really slow release. So what that also does is activate that parasympathetic nervous system, kind of calming us down all over again. And using that with each of your muscle systems can be helpful to kind of bring you down from a really activating or stressful state. And then positive experiences. One of the greatest strategies for distress tolerance, of being able to manage life stressors, is being mindful and checking in with yourself about when's the last time I've done something that was pleasurable to me, that was satisfactory to me, that brought me joy. So I encourage patients to create like a crisis survival kit and think of it as this list of your favorite things, your favorite book, your favorite song, someone that you can talk with about other things that aren't medical, or that I can just feel a sense of safety with, and kind of have that as at your ready is what I would recommend. And kind of creating this list. Often online I use this list, 187 pleasurable activities. I use that with patients to explore new things that could bring them joy or bring them positive experience. So again, the idea is if I build up these positive experiences and engage in them more routinely, when life stressors come, I'm less likely to be as negatively impacted by those stressors as they come up. And the hospital stay tip is a likely reality for a lot of people who live with chronic pain. But one of the things that can be helpful is if some of you all had this experience of, packing a bag for delivery at the hospital, you probably did that in anticipation of the baby prior to the baby coming, right? And so the idea is creating this hospital stay bag that you can have in order to, if that were your fate to be in a hospital, that you have your favorite blanket, you have your favorite pillow, you have your things at the ready so that you're able to be a little bit more comfortable in those settings. Last couple of slides. If all else fails or if all else succeeds, I'm biased, but I'm a big proponent in therapy. Talk to someone. And so I shared this with patients because therapy can look like a lot of different things and can be delivered by a lot of different people. So I'm a psychologist, and one of my values is that therapy is not one size fits all. If you don't have a good provider, there are others. If you don't have a match, there's someone else that can work for you. Don't rule out therapy altogether. And the data says that when patients or clients match on race or gender, they report a greater alliance and increase in outcomes. When thinking about modalities of treatment, CBT, which is cognitive behavioral therapy, and acceptance and commitment therapy are both hallmark treatments for chronic pain. And so think about that when working with your providers to ask, is this something that you're well versed in? They may not be as well versed in your specific condition, but perhaps they could help you help engage in a protocol revolving around these two types of treatment modalities. And again, I'll say this as my caveat, there are great medications that can help with depression and anxiety, but they have a lot of side effects that are also going to negatively impact your heart. And so I like to say therapy has less side effects, but just be mindful of that when working with a psychiatrist. And I always love to tell patients, we have pain receptors in our brain, and psychology studies our brain, but that doesn't mean that this illness is all in your head. As I'm sure a lot of people with chronic pain have experienced that feeling of no one believes me. But talk therapy can actually be extremely cathartic, even in the absence of medication. And so my last little closing thoughts of this study that I reported previously, they found that empathy from providers increases therapeutic alliance, treatment compliance, improvement in overall health of the patient, and patient satisfaction. So I'm imagining that many of you have had that experience with providers where they don't get you or they're not warm. It's hard to do that in a 15-minute appointment. And so I'm always going to encourage my medical colleagues to have that level of empathy for the patient that is actually living with this disease. A common theme, as I said previously, is resilience. And I always want to encourage patients, especially those with chronic pain, that you have agency and in control in a lot of ways in your health. And so I like to include ways to feel empowered. And again, these very brief medical appointments that you have, I encourage people, I do this for myself. I have a note in my notes app that's locked so no one else can see it if someone happens to be my phone. But it's a list of questions that I have for my doctor for my next appointment. My next appointment might not be for 6 months, but something may come up and I have a question, right? Or I take a picture of something and I'll put it in there, right? Remember to tell them that. That can help streamline, because when we're in highly stressful situations like doctor's appointments, we forget a whole bunch of stuff, right? I also encourage people to have binders or some sort of organization system. You're going to get papers left and right, I'm sure, and that can help keep things streamlined, keep specialists and appointments streamlined. And bringing friends and family to appointments is so, so helpful, because it keeps you accountable to whatever the recommendations that providers have provided. And it helps you to ask questions, to have someone else that can make sense of what you learned or what you forgot from that appointment. And so that can help you feel that you're a collaborative member of your own team. And I encourage patients too to have that dialogue, that feedback with their providers, their doctors. They have a medical knowledge of what is a typical course of treatment to some extent for a lot of conditions, and you have the lived experience. And so together, you guys can create the best plan that works for you in your lifestyle. All right. So that is about all that I have in a nutshell. Just try to breeze through that. But please reach out to me in any of these platforms if you have any questions, and I'll have a few more minutes for questions now.